Hi, Mitch here, retired pharmacist with another video on how to possibly treat Raynaud's disease with OTC supplements. Raynaud's seems to be called a disease, syndrome, and phenomenon interchangeably by different sources that you read. The physician, Auguste Raynaud, in 1862, in his thesis that he wrote, described this condition as overreactive spasm of the blood vessels causing reduced blood flow to the fingers and toes. This disease can also affect, in rare cases, the nose, the lips, and the ears. Spasms of the blood vessels occur in response to cold, stress, or emotional upset. Raynaud's affects up to 20% of the adult population worldwide. Approximately 5% of the U.S. population has Raynaud's. If one of your parents has this condition, you have a 30% chance of having it. The body normally reacts to hot conditions by dilating blood vessels and expelling the extra heat from the body. When the body is under extreme cold conditions, the small blood vessels constrict in order to conserve the heat in the body. This conserves heat for the brain, the heart, and the vital organs. The Raynaud's patient overreacts to the cold conditions to the point where circulation is minimal to the fingers and toes, which cause them to turn white or blue. As the patient warms up, the red color returns with a tingly, prickly, and painful sensation. Primary Raynaud's happens without any other illness, which is a positive because symptoms are usually mild. But the secondary Raynaud is more serious. It can attack the body's connective tissue like lupus or rheumatoid arthritis. Skin sores and gangrene, which is tissue death, can occur from a lack of blood flow. The Raynaud's patient should avoid smoking because it can cause blood vessels to narrow. Exercise will help boost the circulation. The Raynaud's patient needs to manage stress and keep the temperature of the body somewhat constant to avoid overreactive reactions to the extreme cold. The Raynaud's patient should avoid decongestants like Sudafed, which is pseudoephedrine, that narrow the blood vessels. Your doctor may combat this by prescribing vasodilators, which open blood vessels. They prevent the walls in the arteries and veins from tightening and narrowing blood flow. Ultimately, the heart does not have to pump as hard. The benefit is a drop in blood pressure. But with these medications comes a long list of side effects. I now want to discuss a group of over-the-counter vasodilators that can help with Raynaud's. L-arginine is the first supplement, which is an amino acid that converts to nitric oxide in the body, which helps blood vessels relax and dilate. This causes more blood to circulate to the fingers and toes. I recommend L-arginine Plus. It's a powder form. Use 1 scoop in water on an empty stomach daily. Be aware, this product has additional ingredients, so you want to look on it to see what's in there. It's mainly for heart health. L-arginine does possess mild blood thinning effects, but they're mild. Pycnogenol is the next supplement I want to discuss because it's quite amazing the more you read about it. This supplement is derived from a pine bark tree. Again, this product acts as a vasodilator to lower blood pressure and increase circulation to the fingers and toes to control Raynaud's. This supplement is a strong antioxidant, anti-inflammatory, which has a long list of beneficial effects. The dose is 100 milligrams once or twice per day in the form of French maritime pine bark extract. Pycnogenol is usually taken with meals. Side effects are rare. Also, to bring up a subject which the men and maybe the ladies will be happy to hear, is the benefits of the combination of L-arginine and pycnogenol improves erectile dysfunction by improving the blood flow. Pycnogenol also helps to reduce tinnitus, which is ringing in the ears, by improving cochlear nerve blood flow or auditory nerve blood flow. The cochlear nerve travels from the inner ear to the brainstem. The cochlea contains the hair cells, which are vital to your hearing. I talked about this subject in my video, Ringing in the Ears, and how important it is to reduce the inflammation in the auditory pathway to prevent hearing loss. The word antioxidant is synonymous with the word anti-inflammatory, to alleviate or prevent disease. And that's why antioxidants are so important. I also want to mention an interesting fact about many bodybuilders. A common practice is to combine L-arginine, pycnogenol, and micellar casein to increase nitric oxide in ATP. The result is an increase in energy, muscle healing, endurance, vasodilation to pump blood vessels and increase muscle size. Another added benefit is the drop in blood pressure to decrease the workload on the heart. This is all I have for today. Thank you for watching and listening to my video. If you enjoy my content, please give me a thumbs up and subscribe to my channel. Mitch, the Retired Pharmacist, signing out.